Hello, and welcome to another episode of Health Essentials. I'm John Horton, your host. Way back in the 1800s, a doctor noticed something interesting about workers in the Waliszka salt mine in Poland. They didn't have lung issues common to many mining jobs. That long-ago observation by Dr. Felix Buchowski is the foundation for today's therapeutic salt rooms and the wellness trend known as halotherapy. But does this age-old belief in the healing power of salty air hold up to modern scientific inspection? That's a question for functional medicine specialist Melissa Young, a regular guest on the podcast. Dr. Young is one of the many experts at Cleveland Clinic who visit us weekly to explore wellness trends. Now let's find out from her whether halotherapy health claims should be taken seriously or with a grain of salt. Welcome back to the podcast, Dr. Young. I always look forward to our paths crossing because I know it'll lead to an educational, fascinating, and let's be honest here, always a fun conversation.
It is, absolutely. And thank you so much for having me back. I'm glad to be here.
Well, we're glad you are here, and you're with us today, so we can talk about salt rooms, or I guess they're also called salt caves. And I always feel like these are the sort of things that there's a lot of curiosity. I know I drive by them all the time, and I just wonder what is going on inside there. So can you kind of fill us in a little?
Yeah, absolutely. And so in Europe, it was found that miners who were working in these salt caves actually had less respiratory issues and better health. So we're kind of taking some of that information, to the US, where to my knowledge, we don't have those salt mines. So, we're improvising and seeing if through creating these salt rooms, and we'll talk about the active and the passive salt rooms, if maybe we might, obtain some of that benefit.
Yeah, well, let's get into a little bit. So there's two kinds of rooms. I mean, what's an active salt room? I just don't think of salt as being all that moving around that much.
I agree with you. So an active salt room is really a truer form of halotherapy. So it uses a salt generator called a halogenerator to sort of release these broken up salt particles into the air, so that these small particles then we can breathe in and maybe have lung benefits, and then have our skin exposed to it. But this is really the truer, closest form of sort of salt therapy or halotherapy.
So you're kind of sitting in a room and the salt's kind of swirling all around you like a salty maelstrom there.
Yeah, I didn't get much information on do you see anything, sort of swirling around you, but and I think this is, less commonly used in the US. Really, most commonly, we're seeing these passive salt rooms where you don't have that generator. They're filled with lots and lots of salt.
Okay.
It could be Himalayan salt, Dead Sea salt, rock salt. It's climate controlled. And this is where especially it's a very meditative experience. Usually there's, low lighting. There may be some light music. So there's a lot of, I think, definite benefit just alone from that meditative quality. And then, perhaps some benefits related to the large amounts of salt, but, less impactful, say, to the lungs perhaps, or to the sinuses than the true halotherapy.
Yeah, it sounds like you're just kind of sitting and chilling in a big salty room for a little.
Yeah. Yeah, and I think there can be benefit to that.
All right, so we you get your active salt room, your passive salt room, and so you kind of set the scene for us as to what we might be experiencing there. Now let's kind of get into how sitting in this salty environment might have some health benefits. How's it going to help somebody live their best life?
So we think about some of the studies, seem to show that it may be helpful, especially for people with some respiratory issues, perhaps asthma, COPD, maybe even a cold and a sinus infection, in that you're going to breathe in these small particles. It appears they may be helpful in an anti-inflammatory way. It also is going to make you more likely to kind of move the mucus that we might have in our lungs or even the sinuses up and out. So you may be more likely to kind of have a bit of a cough to bring that up. So those seem to be, suggestive of the studies. And it's interesting. Obviously, the studies are mixed. We don't have any true clinical trials, but there are some studies that are suggestive that it actually may be helpful in asthma and COPD.
Huh. Well, you could see where you're breathing this in might have some sort of effect. So that does kind of make sense. I thought I read too where these rooms are said to maybe even fight infection.
So I didn't see too much specific data on that, but in my mind, if we're thinking about it medically, if you are getting some of that mucus moving where we might see bacteria and you're getting that up and out or clearing some of the mucus, then the body can actually fight infection better. Perhaps.
Yeah. Well, it seems like it's like a walk-in form of those saline sprays,
Well, and that's the wet therapy. Yeah, this is more the dry therapy, but yes.
All right. What about skin is another thing. It sounds like it might be something where it can help with like skin hydration or just, everyone's always looking for better skin. So is this a possible solution?
So I really didn't see any studies supporting that. I think that I'm always open that we will learn new information in the future, and perhaps sitting in the rooms with the salt and the relaxation might be helpful there, but that I think really remains to be seen.
Yeah. Well, you mentioned relaxation, and I know every time you're on, we seem to eventually get there. Can it help with stress reduction? Is that a byproduct of the salt, or is it just kind of that environment that you're put in that kind of does it?
It's the environment, and we are living in such a stressful world. Any opportunity we have to slow down, take a few minutes, calm our nervous system, I think is clear. It's going to benefit overall health, help us feel better, have better quality of life. And then, perhaps the added benefit of, the salt room and our lungs, our sinuses, might add to that. But certainly anything and everything we do to calm the stress response in the body actually helps our health.
So we've been going over a bunch of these health claims, which these are the kind of the things you see when people tout what salt rooms can do. And they all sound fabulous. But as we were rolling through those, I noticed you kept mentioning there's not a lot of scientific proof behind these. So is this more of a situation where people are sharing all this good things that can happen there out of Yelp reviews and kind of anecdotal evidence?
I think it's a combination in that, I find it very interesting that the observations and studies of the miners who were in the salt mines, where that was really more true halotherapy and more of these active, rooms that I'm not familiar with in the United States, probably have more benefit, and that may be what we're seeing in the studies. The passive rooms, I'm not sure that's clear, and I think it's more maybe community relaxation, and then maybe we learn in the future there is additional benefit. But I have patients who've done these salt rooms, and anecdotally they love them, they feel good. It's unlikely to be harmful. Certainly some people, if you have an active infection, you're not going to want to go into one of these rooms for yourself or for anyone else. It can stimulate a little bit of coughing, so that may be difficult for some people who have more severe breathing problems, but generally it's very safe. And so I don't see anything wrong with it for most people.
So we've kind of been talking salt therapy, and that stuff is fascinating. But I want to take a little side detour
Sure.
We'll touch on Himalayan salt lamps. I've actually got one. It's here right
I can
behind me,
see it
and I usually
behind
have
you.
on in my office. But from what you just said, I'm guessing I should view that more as kind of like a mood light than giving me any health boost.
Yeah, and I have one as well. And so it's also not Himalayan salt; it's salt from Pakistan. That can actually have a glow when it's lighted. So I think of these salt lamps as, again, relaxation response. But it is interesting when we think about, could it be generating some negative ions? Again, not a lot of great, randomized clinical trials on negative ions, but we know when we're by the ocean or in the forest, in nature, these negative ions are abundant. And so it is relaxing. Maybe it helps a little bit with mood. So I think those salt lamps, can be great, but bring plants into your home, go into nature for, the best benefits. But it was interesting in reading a little bit more about the salt lamps. The only two caveats are, it can be toxic to pets if they lick it. So
I'll keep
make
my dog
sure,
away from it. Make sure
yeah, and my
Charlie
cat.
keeps his distance.
And they're potentially a fire hazard if you leave them on unattended. But otherwise, I think they're very safe. I love mine. It creates kind of an ambience. But if you want real benefit from negative ions, sure, we can try the salt lamp, but definitely go into nature.
Now, in hearing all of this, the whole idea of that salt therapy, and we talk like you go to the ocean and you sniff that air and you do just feel better.
You
And
do.
I always just thought it was the ocean and being at the beach that was doing it,
I
but
think it's a combination.
maybe it is the salt too. I mean, I guess you kind of understand then why this whole notion of salt caves and salt lamps and kind of getting that into our lives, might be beneficial or might be something people want.
Yes, and I think generally, as we were talking about, these things are safe. So that's the most important. And then, yeah, hopefully we'll learn more about, better studies in the future. But I think there are elements of, truth to this. And again, it's not causing harm. So, I think it could be worth trying for people who are interested.
Yeah. Now you said low risk, which obviously does not mean no risk. So just want to go over a little bit of if there's maybe some people who should avoid kind of salt room therapy, or if there's any other kind of concerns that might come up.
Sure. So some of them can be on the small side. So if you tend to be claustrophobic, it may not be ideal for you. If you have an active infection, one, you don't want to expose anyone else to that. I mean, a respiratory infection, maybe as you're recovering, and if you have a cold or bronchitis at the end of that when you're not contagious, see if it might have benefit. But, for people who have more chronic lung disease, asthma, COPD, where it's suggestive in the studies there might be some benefit, know that since it can stimulate a little bit of coughing and, because you're clearing some of the mucus or moving the mucus, that may be uncomfortable for some. And so using judgment on whether, that's a good fit for you.
And there's no standards on these sort of salt rooms either, right? Like, yeah, I'd say you don't really know what's in there.
Well, I absolutely agree with you. And, some of them, if they're not, really well climate controlled, you could have, overgrowth of bacteria or mold as a possibility.
So make sure it kind of looks like a reputable place and things, you just use your senses when you walk in and you kind of look around a bit.
Look around a bit, do some research, ask them about their experience in creating those salt rooms.
Now, I know when we were talking at the start, with a lot of these sort of treatments, these alternative treatments,
Yes.
They're all, there's a hint of truth in all this, where you kind of see that benefit, and there's a little bit of proof there. But I know we always kind of get to the point where people should not maybe substitute these sort of things for like professional medical care. If you've got breathing issues, you don't want to get rid of your machines or some medication you've been prescribed because you're going to a salt.
Absolutely. And, we never want to substitute these therapies for our traditional allopathic therapies. I think we can, run into a lot of trouble. What we're looking at is this, can this be complementary to your regular treatments? Kind of coming back as well to that calming of the stress response. When we're, in fight or flight or in a stress response all the time, that production of cortisol, one of our main stress hormones, drives inflammation. So, whatever we're doing to kind of calm that is going to have physiological benefit. So, again, using common sense, but no, don't stop your medications. Don't use this in place of, say, asthma treatments. But, it could be fun to try, and it may have some benefit, but not in place of.
So just kind of talk to your doctor, tell them you want to try this halotherapy or salt room thing, and just kind of walk through it with them just to make sure you're not harming anything.
Always. Yes, please always talk with, your physicians and make sure they don't feel there's a contraindication, that you would not be aware of.
So bottom line here, from everything that you're saying, it sounds like salt therapy is something that people can maybe give a try if they're interested in it. They don't just, salt doesn't just have to be left in the kitchen. You can maybe use it in another way.
Yes, absolutely. I agree with you. And, some people have interest in trying these, new things. And, as long as you're using common sense and sort of thinking about the things we've discussed, I'd say, see, how that works for you.
And if it makes you relax, which we have talked about so much on this program when you come on, it sounds like there's no harm that is going to come from that.
Exactly. Yes.
All right. Well, Dr. Young, you always manage to kind of take the stress away from us and help us find our happy places. So appreciate you coming on again and sharing your wisdom, and can't wait to have you back.
Thank you so much.
The notion that breathing in salty air offers health benefits has been around for almost 2 centuries. And while science may not support some of the claims, there's no shortage of people who swear by the alternative treatment method. So if you want to try it, go ahead. Just don't expect miracles or substitute it for prescribed medical care. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.